Hello, everybody, and thank you for joining us on another episode of 8 Questions in 8 Minutes. And today, we're going to be discussing with Dr. Mary Litchford a lot on longevity and anti-aging. Dr. Litchford, thank you very much for joining us on 8 Questions, 8 Minutes. It's a great pleasure and honor to have you with us today.
Well, it's always a pleasure to work with you.
Thank you very much. Let's move to our first question. What role do antioxidants play in mitigating oxidative stress, and how can dietitians incorporate antioxidant-rich foods into anti-aging dietary plans?
Well, I think the first question is, what's oxidative stress? Now, oxidative stress is an imbalance between free radicals and antioxidants. And if you have that imbalance, it can lead to cellular damage. And so your organs don't work like they should. Now, free radicals, we always associate it as the bad guys, but free radicals are a byproduct of energy metabolism. And so they do play an important role. They also play an important role in immune support. And so what happens when you get that imbalance between the antioxidants and the free radicals? Well, if you get too many free radicals from stress, from exposure to air pollution, smoking, vaping, excessive sun exposure, or many medications may increase free radicals as well, then you have this imbalance. And so excessive free radicals will damage cells and increase your risk for diseases and promote aging. Now, the way to counterbalance that is with more antioxidants. Antioxidants are found in foods, and your body prefers them from foods. And so the key ones are ascorbic acid, vitamin E, beta carotene, and selenium. There are other antioxidants, but those are really the key ones, so that by adding those nutrients from whole foods to the diet at every meal, every day, and reducing those ultra-processed foods are really the key to answering this question about anti-aging dietary plans.
Brilliant. That takes us to our second question. How does caloric restriction impact the aging process? And what practical strategies can dietitians use to safely implement caloric restrictions in their patients?
Well, I think most adults want to lose weight without restricting the total number of calories they consume every day. But what the research is showing us is that from the calorie trials, now that stands for Comprehensive Assessment of Long-Term Effects of Reducing Intake of Energy. The 2-year trials showed that a very modest reduction in total caloric intake had very positive results, and it was only about 12%. Now, we usually think about losing weight. We want to cut calories to the bone, so very low calorie diets. That's not what this literature is showing us. It's showing that even a modest reduction of around 12-15% of caloric reduction will have some positive effects, such as addressing markers of dyslipidemia, addressing markers of inflammation, of reducing leptin in the body. And it also can have positive markers in terms of diabetes management, so improves glucose tolerance. So just that small reduction makes a difference. So work with your clients on what they're willing to do and what's reasonable for them to do in terms of caloric restriction.
That's in line with the SMART goals that they can put, so this can reinforce that idea with the patient. That takes us to our third question. Which specific nutrients and vitamins are most effective in supporting skin health and reducing the visible signs of aging?
Well, I think the real question is, how can we avoid wrinkles? And you didn't ask that, but that's really what your clients want to know. Because that's one of the visible signs of aging is wrinkles. Now, remember that the skin has two primary proteins, collagen and elastin. You can make collagen your entire life. But elastin is a different story. Elastin is synthesized in the body during the fetal development and in the first 30 or so days of life. After that, your body does not make any more elastin. Elastin is the protein that gives your skin recoil, so it doesn't wrinkle. So why do you wrinkle? Well, you've either lost a lot of fat and muscle in your face, and so with rapid weight loss, sometimes you will see that. We've seen that with some of these anti-obesity medications where people have lost a lot of weight and their faces show a lot of wrinkles that they weren't expecting, because the loss of elastin means the skin doesn't recoil to its former size. Now, the way that we address healthy skin is to be sure that we have adequate hydration, we have adequate protein so the body can make collagen and other muscle tissue in your face, and of course maintain the fat stores, not too many, but an amount where your face doesn't look really wrinkled. Okay. And your antioxidants. And so again, it's that whole foods diet that is high in antioxidants and provides complete protein that really makes a difference. People ask me about, well, what about the collagen products? Since skin is made from collagen, and collagen's probably the most common protein in the body. Well, remember that when you eat protein, the body breaks that down into amino acids. And those amino acids are reorganized into other body components. So consuming collagen doesn't make more collagen and make your skin healthier, because you're not absorbing it as a whole protein or even the bipeptides. And so you want to be sure you're meeting all those essential amino acids. Now, collagen protein in its natural form does not contain tryptophan, which is one of the essential amino acids. So again, it's the complete protein, it's the antioxidants, and adequate hydration.
Brilliant, which obviously takes us to our fourth question. How do dietary patterns such as the Mediterranean diet contribute to longevity and reduce the risk of age-related diseases?
Well, the two diets we hear the most from our researchers as having an impact on reducing aging and age-related diseases are the Mediterranean diet and the DASH diet. These diets focus on reducing inflammation, whether it is to prevent disease or to manage disease. Okay. And so what is similar about these two diets? Well, they both focus on a balance of macronutrients. So high quality carbohydrates, high quality protein, and healthy fats. They focus on consumption of whole foods and using minimally processed foods versus our ultra-processed foods. And a lot of the foods we see in the Western diet are high in sugar, high in fat, ultra-processed foods. And these diets provide a different route to meeting your energy requirements with healthy foods and a balance of those macronutrients. This is what's recommended not only for healthy adults, but for adults with many chronic conditions, rather than the very strict diets that we used to recommend, years ago. Back in the 20th century, we had very rigid diets for nutrition management of different diseases. Now the focus is more on that Mediterranean and DASH diet approach.
Which takes us to our fifth question. What is the relationship between chronic inflammation and aging, since you tapped on that earlier, and how can anti-inflammatory diets be optimized to support healthy aging?
You know, the question is, what came first, inflammation or oxidative stress? We know that inflammation drives oxidative stress, but we can also expose ourselves to things that promote the production of free radicals, and excessive free radicals drives inflammation. And so the goal is to have healthy lifestyles where we not only include diets that are include anti-inflammatory foods, such as what's recommended on the Mediterranean and the DASH diet, that we're sure that the components in the diet that aren't as healthy are consumed in moderation. And so foods that are high in sugar, foods that are alcohol dense, those things we want to be sure we have low levels of, because that will help reduce the amount of free radicals, because we want to be sure we've got that balance between our free radicals and our antioxidants to help preserve the cells in our organs. Now, our organs are going to age, and so there is going to be some loss of cell function over time. But our goal through diet is to optimize all the cells in your body right now to help you stay healthier throughout the life cycle.
To add to the complexity here, let's move to our sixth question. How do changes in the microbiota with age affect the overall health? And what nutritional interventions can support a healthy microbiome in an aging population?
Well, the gut microbiome is a topic of great interest in research.
Sure.
And we know that the gut microbiome is a transducer or a sensor of environmental signals. And so it's kind of this hub of information that communicates with all the different organ systems. We know that the gut microbiome can modify our risk for disease.
Sure.
And that's true across all age groups, in young adults, middle-aged adults, and older adults. The gut microbiome can be negatively impacted by disease, by medications, by low-quality diets, by lack of sleep. And so it's very important that we stay away from the inflammatory foods, and focus on more of our anti-inflammatory foods, our antioxidants, and our polyphenols. Now, we also see that foods that are high in fiber are very helpful in maintaining a healthy gut microbiome and a diversity in the gut microbiome. Fermented foods are another area where we're seeing improved gut health. There's a lot of research about other things that may improve the gut microbiome. Most of those studies are only done in animal models, and we don't have enough data on adults to really make some conclusive statements. So looking at increasing foods rich in antioxidants and polyphenols, high fiber, and fermented foods are the three areas where we have the most data to support ways to improve our gut microbiome.
Since we're talking about elderly here, that takes us to our seventh question. What is the impact of protein intake on muscle mass preservation in older adults, and how should protein needs be adjusted as patients age?
Muscle mass changes over the life cycle. When you're young, you synthesize more protein than you break down. As you get older, there's a balance between synthesis and breakdown. But once you reach, age 40 or so, you start breaking down more muscle mass than you are replacing it. And so the question is, how can you reverse that? How can you have that balance of synthesis of muscle versus breakdown, or making more muscle mass than you're breaking down? Well, we know that if you live long enough, you're going to lose muscle mass as a result of aging. But we also know that inactivity and inflammation are two factors that will contribute to that shift towards breaking down more muscle than you are building muscle. And so what do you do about that? Well, one piece of the puzzle is exercise, and not just strolling around the house. It's resistance exercise. It's intentional exercise to really build and maintain your muscle groups. And then the second thing is to be sure that your diet not only meets your energy needs, but also meets your protein requirements. Now, the RDA for protein for adults is 0.8 grams per kilo of body weight. And there's really no consensus on what the special number should be for older adults. Now, an older adult is someone 51 or older. And the studies show that between 1 gram per kilo to up to 1.5 grams per kilo is a level within that range, is a level that's reasonable for adults over 50 to help compensate for the increased loss of amino acids that we see through digestion. With older adults, we don't utilize protein as well, and to repair and maintain the body because the body becomes more susceptible to injuries.
Sure.
So I always recommend not only the exercise component, but being sure that we're getting sufficient amount of protein that's high in leucine. Now, leucine's your most anabolic of your amino acids. That means it's going to promote the synthesis of muscle protein.
Yeah, great. That leads us to our last question. How can dietitians address common nutritional deficiencies in older adults to prevent cognitive decline and maintain cognitive health?
Well, the first nutrient is water. Dehydration contributes to at least short-term memory loss and cognitive decline. If you are 10% below your normal level of water, so really only slightly dehydrated, maybe it's very hot outside, it's very humid, you are more likely to make mistakes and forget to do things just because you're dehydrated. So that's an easy one.
Yeah.
The other nutrients that are associated with cognitive decline and are important to maintain cognitive health are vitamins B12, folate, and vitamin B6. Well, let me add one more thing. The body prefers getting that B12, B6, and folate from foods rather than from supplements. For some individuals, you will have to use supplements. Many medications will reduce the levels of these nutrients in the body. And so for those individuals, we may not be able to meet those needs with food. But again, you would look at the medications in the context of any of their markers of status for B12, folate, and vitamin B6.
Mary, I would like to thank you very much for being with us on 8 Questions, 8 Minutes. It's been a great pleasure to have you with us. And just to note for everybody that Mary was the person who introduced nutrition-focused physical assessment with Catalyst back before COVID in the Middle East. And Mary circled all around the Middle East, spreading that knowledge. And we're hoping after COVID, which is nowadays, we are actually spreading the nutrition-focused physical assessment knowledge at a higher level, at the level of competencies across the region. Mary, thank you very much for being with us. Everybody, thank you for joining 8 Questions in 8 Minutes, and we'll see you on the next one. Thank you.